Hello, my name is Eric Worley, and I'm with Summit Pointe, a community mental health organization in Battle Creek, Michigan. Summit Pointe is introducing a new youth treatment program in Calhoun County called Therapeutic Home, and I've invited a few experts on the program to answer some questions and the impact it'll have in our community. I'm luckily joined by John Ahrens, the president of Treatment Foster Care Consultants based in Eugene, Oregon. Prior to joining Treatment Foster Care Consultants, John worked in the field of juvenile justice as a practitioner and leader for over 35 years. John was responsible for the implementation of culturally competent, evidence-based interventions designed to reduce recidivism and encourage pro-social development in youth offenders across the spectrum of programming. Along with two colleagues at Lane County Department of Youth Services, John developed and has implemented Options to Anger, a nationally recognized evidence-based model aimed at reducing anger and violence. He has published numerous articles addressing anger reduction and co-authored a book on the field of juvenile justice, Dispatches from Juvenile Hall: How to Fix a Failing System. I'm also lucky to be joined by Deirdre Laney-King. She is the program manager for the Michigan TFCO initiative. She has worked in administration for children's mental health services for 7 years and is passionate about innovative programs that keep kids in their communities. She currently works at Wayne State University in partnership with Michigan Department of Health and Human Services. So thank you both very much for joining me today. So you heard me say a couple times, Treatment Foster Care Oregon, Treatment Foster Care, TFCO. So Treatment Foster Care Oregon is the treatment model we're going to be using for the Therapeutic Home program. TFCO was developed as an alternative to institutional, residential, and group care placements for children and youth with severe emotional and behavioral disorders. So I'll start with John first. John, can you describe just a little bit about the TFCO program, just kind of broad strokes, and then can you touch on what some of the key focuses of the TFCO model are?
Thank you, Eric. I'm pleased to join you and Deirdre today and happy to talk about Treatment Foster Care Oregon. And it is a community-based intensive treatment model that is child and family centered. So simultaneously, the clinical team that makes up the TFCO team works with the young person in a highly trained and supported therapeutic home, and also works with the forever family, that aftercare family and forever placement for the young person. The team supports community activities and school activities. Really, it's a child and family focused intensive treatment that happens, that's built in the community the young person lives in.
Excellent. Again, I'm also joined by Deirdre Laney-King. So Deirdre, what makes a program like this so important right now? I know there's the pandemic going on, and that's led to an increase in our awareness on our mental health. But even before the pandemic hit, what makes a program like this that keeps kids in the community so important?
Thanks, Eric. Yeah, just to kind of complement what John was saying, research is showing more and more that kids do better when they stay in their community. They have better mental health, they have better outcomes at school. So being treated in the community teaches kids to succeed in the community. It's really important that we respond to what we know works and what science is telling us works. And that's exactly what Summit Pointe is doing right now with this program.
John, you touched a little bit before on some of the, and Deirdre as well, some of the positive outcomes. Can you get a little bit more in depth? Like, what are some of the things that the kids will see? What are some of the things that the community and the families around them will see as an effect of this program?
Thanks, Eric. We have 8 randomized control trials, and as Deirdre mentioned, science is important. But let's boil, what does science mean at the street level, where, if you will, the rubber meets the road? And so in terms of outcomes, we see young people, most importantly, staying in the homes where they reside. We don't see escalation in placement to institutions and that sort of thing. We see young people less often escalating in the system. So getting new charges if they have some juvenile justice pieces, or more increased need for psychiatric engagement. So in a hospitalization or higher level of treatment. on the, I think the really important level, on the level of a whisper of an outcome, if you will, they're more successful in school. And that means more attendance. That means more likely to engage with that positive adult mentor many of us can relate to when we think back to our school age. Who's that person that really helped guide us? They're more likely to maintain employment and be successful in engaging employment. And long-term outcomes, they are more likely when they have children of their own. So we're looking from the adolescent model, which Summit Pointe is doing, 10 years post TFCO, they are much less likely to have involvement with systems for their own children. So mental health, child welfare, juvenile justice. So that breaks that cycle of intergenerational system engagement.
Yeah, that's so important to like I said, stop that cycle and to kind of get people off that merry-go-round where they just keep going around in circles doing the same thing generation after generation. So Deirdre, who are these kids that are going to be benefiting from the TFCO program? Like, what's their background? What have they been through? What kind of traumas have they seen?
So currently the youth that are eligible for this program are youth who are at risk for entering the hospital or other group care settings. So like group homes, crisis residential centers, sometimes juvenile detention centers, due to their behavioral needs. And what we know is that young people usually act out what they need more of. So if you have a young person that is not going to school, that's not necessarily paying attention to their caregivers, that's not respecting boundaries of the home, what we know is that young person needs more guidance, more boundaries, and more predictability in their life. So we're talking about youth who are at risk for leaving their community because of their behavioral needs, like John said, kind of moving up in a level of care. TFCO at Summit Pointe provides an option for youth who otherwise would have had to leave their community to receive high levels of support through this program. More treatment options in the community means more practice living in the community settings for youth who could end up in psychiatric hospitalization or juvenile detention. And what we know is that if youth spend long periods of time in a psychiatric hospital, juvenile detention, that's where they learn to succeed. They learn to succeed in institutions. And when we think about those long-term outcomes and really thinking about multi-generational outcomes, we want youth who learned how to address their own behavioral needs, address their emotional needs, lean on their support systems, and have reliable adults in their life so that they can move forward and see the outcomes that they have, the goals that they have for their life.
Yeah, I think that's the population we need to really focus on, and I think we can help them. I think this program at Summit Pointe can definitely help do that. John, any more effects that you think programs like TFCO have on the community? Like, what benefits will the random person walking down the street, like what can they benefit from with a program like this being implemented?
Thank you, Eric. I was so heartened as I listened to Deirdre describe both the match with Summit Pointe and how that fits in the community and supports the kind of outcomes long-term that we know are most effective or more effective for young people and families. And so expanding on that a bit, first of all, I think it's so important to take a look at the innovation that's happening in Michigan and that partnership between Michigan Department of Health and Human Services, Wayne State University, and agencies like Summit Pointe. So I want to applaud that. And I like your question about what makes sense in the community. And so let's think about it practically. When you have young people and families that are more successful, you know, oftentimes we think of the young person, as Deirdre described, that's in need of increased level of treatment. If TFCO is not an alternative, those families often have siblings that will also benefit from the model. So as we think about radiating out, there's the increased parenting skills and increased support and those sorts of things. But beyond that, this is the practical side. We keep people local. We keep them engaged in the community. We reduce costs long-term. When we look at costing, it's tempting to think of short term, how do we manage this particular problem? But long term, if we engage community members as the TFCO therapeutic parents, it's less expensive than an institution. If we have young people that in families that pull on the system, if you will, in different ways, that's less expensive on the system when they don't do that. And also, I think it's very important to think about communities as the solution, right? That we have, as you build the cadre of TFCO therapeutic parents, these are community members who want to weave that fabric of community support that's so important as we think about the culture and connectedness of our community.
Yeah, so we're not just helping these kids and their families, we're helping the entire community be a little more successful, a little healthier.
Well, we're having the community be the solution, which is so true, and build out the fabric and support of that community. And with the partnerships of an agency like Summit Pointe, Wayne State University, and of course the state level, which really gives it that strong structure to look at system change as well.
It really does take a village. Sometimes that village is the whole state, but it's still a village.
I agree.
So Deirdre, we've said the words foster care a couple times. So what makes the TFCO program different from foster care people might be used to dealing with?
That's a good question. We're spending a lot of time in Michigan differentiating this from traditional foster care because Michigan is the only state implementing TFCO through the public mental health system. And this program is different from foster care because youth come to the TFCO program at Summit Pointe because of their mental health needs, not because their families became involved in child welfare or because they were court ordered. We do require that the youth's family participates in the program. So it is a family treatment program. And although it's not foster care, we are using treatment foster care Oregon model because we know it's well researched, it's internationally utilized, and it gives us a solid foundation for providing this mental health service in Michigan and more specifically at Summit Pointe. And so the therapeutic parents that will work with Summit Pointe are actually mental health providers. They will become contracted employees of Summit Pointe agency, and they will be delivering mental health treatment in their home as a part of that clinical team.
So John, so we've talked about these heroes we're looking for, these therapeutic parents. So what does it take to be a successful therapeutic parent? Like, what are their skills? What are their tricks of the trade, so to speak?
Eric, I love the question, and I'm smiling because they really are heroes. They are a critical part of the treatment team. So these therapeutic parents are people who are team players. They're interested in learning. They're curious. They are tenacious about wanting to be a part of the solution for young people in the community. And they come from all different sorts of areas. We have people who are retired, that we have people who are professional folks and wanting to contribute. In addition, they're folks who are juggling full-time jobs, may have children in their home as well. And these are folks who are curious about learning, want to be part of the team, are comfortable with engagement with the clinical team. They have intensive training and intensive support. So these are folks who are in the mix, and they have a good sense of humor. We often joke now, this is happening across Zoom at the moment, but we're going to be back together in person again before too long. And what's often said is that when the therapeutic parent meeting happens, which happens once a week to support delivery of services and support each other, that they're noisy enough because they're both having fun and talking about things and engaged, that people around them either want to be part of the meeting or they want them out of the building somewhere quieter. So they're folks who are absolutely part of the treatment team. They're critical, and they're curious, and they're willing to trust the science enough to follow the model. So that's a part, and so those are some of the critical ingredients. Have fun, have humor, and be willing to work hard and support young people.
Excellent. Well, thank you so much for your time, John and Deirdre. I appreciate you taking a little time out of your day to speak with me. Even if this wasn't a pandemic, we probably wouldn't be in the same room because John's out in Oregon, Deirdre's over in Detroit area, and I'm in Albion. So I'm glad to see you both today. And hopefully you have a good rest of your day. Thanks for taking some time to join me today.
Thanks, Eric.
Yeah, if you sound like the kind of person John was describing, if you're interested in being one of our therapeutic parents or just learning a little bit more about it, feel free to contact me. My email address is emw@summitpointe.org, or you can give me a call on my cell phone, 269-300-9023. So thank you for taking the time to join me today to watch. Thank you to John and Deirdre for taking the time to educate us on the program, and we hope to talk to you soon. Thank you.
Thank you, Eric.